Hey guys, we're looking at a corn on the foot of a patient here, and you can see when we look at the foot, it doesn't look like it's that big, but then we put some alcohol on that and you can see the quite well outlined corn here, and it's got this apex right in there, so the corn's sort of sitting down and in that way. So this one's we've treated a few times. It's actually getting a little better, but we'll regularly treat this one. So as usual, the first thing we do is just trim back the callus cap that sits over it. And remember, we talk about a corn like it's an ice cream cone with the ice cream sitting out this way in the skin and the cone pointing back towards the inside. And you can see all of a sudden that that corn doesn't look so big once we've taken that callus cap off. So it's really important. What we do is we feel, while there's no blood there, we can feel where the corn and what the actual hard section is, because sometimes it's a little bit hard to see. And you can see now in here, once we put a bit of alcohol in there so we can see through the skin, we can see, I'll try and get it in the light properly, that this corn is sort of a U shape, which makes it really quite difficult to get out. So we'll just trim gently down this way, and then up to the top that's a little bit thinner, so we've got to be a bit careful there. Down to the bottom, trim around the top there nice and thin. You can actually hear when I'm cutting the hard corn versus the normal skin, so it'll actually flick when I cut the hard corn, and you won't hear anything when I cut the regular skin. That's another way we can tell. You can see just under it, it's got this macerated white section where the fluid gets pushed out of the corn, and that's the corn in my fingertips there. And then we'll do a close-up, just clean it up a little bit, try and make those edges not so vertical. And we'll have a close-up look at that, and you can see right where the tip of that corn's come out of, that little shadow there, and the corn was sitting in through here. So that will be instant relief to get rid of that pain. And that's how we treat a hard corn on the forefoot.